how can I stay off the drugs, or should I go on to drugs? And the answer to that is not whether you should or shouldn't, but whether you have to or whether you don't have to. And so we don't want to apply opinion on this. We want to apply quantitative data to decide whether or not you need to add drugs to your regimen, or whether or not you don't need to. So let me give you an example. There is only 5 ways that you can lower pain. Okay? Now, those 5 ways are through diet, exercise, medications, and to a much lesser extent, supplements, and things like meditation, okay? Or stress reduction. But the majority, the biggest impact items are medications, diet, and exercise. So if we focus on those 3, just for the purposes of this video, because that's like applying the Pareto principle, the 80-20 principle, that's where all the action happens. Now, let's look at the for and against of each one. The benefits of going down the dietary path is that you can get results immediately, right? Just to give you an example, the extreme example is by not eating. If you don't eat and you just do a celery and cucumber juice for 2 days, or you do a water fast for 2 days, about 19 out of 20 people, in my experience and reading the scientific literature, 19 out of 20 people get dramatic, extraordinary pain relief. And if they were to keep that up for a week, would basically be completely pain-free. Okay, so that's the extreme version. And then a much less extreme version, if you were to do something like the baseline phase of the Paddison program, then you would also get a dramatic and fast pain relief. Not as good as fasting, but of course fasting's unsustainable, but you would still get dramatic pain relief quickly without side effects, and in fact huge other benefits like reduce your risk of other chronic diseases like cancer and diabetes and heart disease, and extend your life by 7 years on average by eliminating meat and dairy products. So that's one way. Diet is one way. Now the other 2 major ways that I mentioned, one of those is exercise. Now, exercise acts like a giant painkiller. That's what it is. It's like a medication that you take every day because you must exercise every day, and it will give you dramatic and fast pain reduction. But I'm not talking about going for a walk. I'm talking about doing exercise at a level that really gets your heart rate up, a level that enables you to sweat. And it's not the sweating itself that gives you the relief of symptoms. So it's not toxins leaving the body, although that may be a part of it. It is the whole experience of having the change of breathing, the movement through your joints, the elevated heart rate and the extra blood flow through your body, and a combination of the movement of your lymphatic system, the waste removal system, and all of this combines together to give you dramatic pain reduction, like a giant pain reduction pill or a medication, without side effects. And again, massive benefits, like simply becoming fitter, improving your lymphatic system, eliminating toxins, eliminating waste, and just feeling healthier. And I think that we don't need to go into too much detail about why exercise is a tremendous thing to do. There's a lot of other videos that I have about different ways to exercise, but as a broad statement, elevated heart rate, 30 minutes to 45 minutes a day, during which the latter part of that you begin to sweat, and you have just done probably the equivalent of a 2 or 3 or 4 milligram dose of prednisone, or the equivalent of, in terms of pain reduction. So that's an absolute no-brainer, right? So we've covered diet, we've covered exercise. Now, if you're on the baseline phase of the Paddison program and you're exercising daily in the way I've just described, or doing something like Bikram yoga, which is my, preferred and most highly recommended form of exercise for people with inflammatory arthritis, and you're doing those things and you're C-reactive protein and your SED rate are still elevated after a couple of months, then there's not a lot of wriggle room left, and some medications is going to be required to mop up that additional inflammation and bring your inflammation levels back into the normal range in your blood tests, and also make sure that your physical symptoms are clear as well, because it's a non-negotiable that we want to have very low inflammation levels or minimal to zero inflammation levels in our body. That's a non-negotiable. It shouldn't be, should I go on drugs, should I not go on drugs? It's, does the ultimate dietary program plus the ultimate approach with your exercise get you far enough? And if it does not, then yes, you need to take some medications. And then, of course, medications, if that's what people choose to do right from the start, which is the pharmaceutical approach, is to put people immediately right on the medications. Of course, this can have sometimes some massive and fast reduction in pain, most of the time, especially something like prednisone. But the side effects are massive. And so, for me, and my approach to these things is to get everything perfect that we can control naturally, and then what's left over, control artificially. So that's my view on the medications and whether or not one should or shouldn't. It's about whether or not you need to or you don't need to. If you're on a lot of medications already and you are half-heartedly doing Paddison program, and maybe you're doing a little bit of exercise and your blood work's not ideal, then the answer, in my opinion, is not to look at more drugs. It's to get the first two right, and then once they are right, see whether or not you need to add more medications to the mix. That would be my personal opinion, okay? So I hope that's cleared things up with regards to medications and their necessity. I would always look to try and perfect the diet, perfect the exercise before adding the additional meds, because the first two not only come with no side effects, but come with limitless other health benefits. And so I hope that's been useful, and thanks for watching. I'll talk to you in another video.